it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about retained baby E's. And what is an E? Well, this is a little different than the numbering system here, but an E is a second 2-year-old baby molar. It's right here, and below the E and right here is a permanent tooth, which we call the 5 or the second premolar. It's also tooth number 4, 13, etc., etc. So very commonly, genetically, people are congenitally missing their 5s, which means they only have their E's, which is a tooth that wasn't meant to last a lifetime, but it can last a lifetime if it's well taken care of. It doesn't always. You can't always control it. I can tell you that my own mother has, I guess it must run in my family, I think she has a few, if not, I know she has more than one. And she's in her 70s and she still has them. So if you take care of them, you make sure they don't get cavities, you take care of their perio, you don't try to move them or tip them or anything like that, you handle the occlusion on them, you handle the wear, you handle the forces, then they very well, handle the bite, can last a whole lifetime. But more commonly, I see a lot of doctors thinking, and even patients, this is a baby tooth, it needs to go, I'm going to treat it like a baby tooth, which you shouldn't be. You should be treating it like a permanent tooth that you need to take extra good care of. So you don't necessarily want to move it orthodontically. And you want to build your orthodontic treatment around leaving that tooth alone. And to be really honest, the easiest way to deal with it is using an aligner system. I often use Invisalign because I feel like I have the most control with them. But you use your aligner system and build the treatment around that tooth. Now, of course, this tooth, we call this E space. This tooth is a little bit bigger than, I think this is a little bit exaggerated, than the tooth below it. A premolar is normally around 7.5 to 8.5 millimeters, whereas an E is probably closer to, I think there's a leeway space of about 2.5 to 3 millimeters. So there's a fair amount of space in the tooth size differential. So if you only have one and you don't have 4, then your midline is going to be a little bit off. And because this tooth is a little bigger than the one on the other side, bite is not going to fit together. So you might have to add a little bit of IPR to get the bite to fit together. But that's okay. There's nothing wrong with that. As a matter of fact, if you want to, you can even zing off the mesial and distal of this one to try to get it to fit together well. But whatever you do, I would not pull it out. There's a few scenarios where I do pull it out, and that is when it's just meant to be. Let's say we had a patient that wasn't growing and had severe crowding, and it was one of those ones where we were considering 4-bite extractions anyways. They didn't want surgery, they weren't growing, so we couldn't do growth modification. Well, in that situation, hey, it's meant to be. We got baby teeth with no permanent ones, let's just pull those, But that's very rare. Or you have a bite issue. I've had some where we have a huge overjet. Again, patient no longer growing, so we can't do growth modification, we can't grow the lower jaw. This might be a case where they'd pull out upper premolars anyway. So if we have a retained E, take that one out instead. And the one on the other side, of course. You can't just take out the one. But it's almost impossible to close just that space unilaterally on one side on one arch. You basically have to create space on all the other quadrants and close those as well, or you're going to have a really lopsided bite, a cant, a midline that's off. It's just not going to work. So that is the biggest misconception, is that doctors and patients think, oh, we pull this baby tooth, we can close it later with orthodontics. No, you can't always do that. And what's going to end up happening is that the teeth around it are just going to tip in. You're going to start to lose the bone that you could have used for an implant. And then later when you need an implant, you're going to have to get a graft. It's going to be more painful. It's going to be more expensive. So why not just leave that tooth alone to begin with? So anyways, moral of the story is leave it alone. Don't pull it out. All right. Thanks so much.